disease. We're so glad that you're here to participate and listen and learn in our webinar this evening. What I'm just going to tell you a couple things about how things are going to happen tonight. We do hope that it will be an interactive program. Our format includes a short presentation followed by an interactive discussion. At the end, you will you will have a chance to ask some questions. You'll type the questions To type the questions in, you'll use the question section of the webinar toolbar. You can expand that with that square to help you see it better. And we look forward to this being an interactive webinar. Now, some disclaimers. We know that the information that you're about to hear may motivate you to make some lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health registered dietitian will provide strategies to help manage your CKD. And the online questions, like Q&A session, is intended to give general advice. This information is not a substitute for personal medical advice, and it does involve just professional opinion of the Cecilia Health registered dietitian. All right, and so that dietitian is Emily Stott. She is here tonight to present to you. She graduated from Illinois State University with her Bachelor's of Family and Consumer Science, and then she graduated from Eastern Illinois University with a Master's in Dietetics. She's previously worked as outpatient registered dietitian and certified diabetes care and education specialist at 2 different outpatient clinics before working with Cecilia Health. And she has been educating patients about diabetes, cardiovascular disease, weight loss, chronic kidney disease for the past 10 years. She lives in East Tennessee and enjoys hiking with her family. So she is going to take it away from here. All right, Emily.
All right. Thank you so much. Hi, everyone. Thank you all for joining us this evening. Like Ashley said, our main focus tonight will be on cardiovascular as well as chronic kidney disease tonight. And so here, as we start off, we'll see our agenda. We're going to really first focus on what is heart disease and how is it, along with chronic kidney disease, why are we talking about both of those topics together? And then we're just going to really dive more into heart disease. So we're going to focus on the symptoms, the causes, the tests, and also treatment and prevention that come right alongside of that as well. So, and like Ashley said, we will have time for Q&A at the end. And if there's anything that is very specific to your to what you have questions about, I'll probably just direct you back to your doctor with that as well. But thank you again for joining us this evening. So first of all, what is heart disease? And as you can see here, it's a range of conditions that affect the heart. So there's several things listed here. If you yourself have heart disease, you might see one or two of them that you're like, oh yes, I've talked to my doctor about that. So this could be coronary artery disease, irregular heartbeats, maybe something that you were born with, or some type of disease of the heart muscle, or a heart valve disease. So there's a wide range of different things that we'll be talking about tonight, different medications that help for, again, very specific needs for the heart as well. So, but you will also see that a lot of forms of heart disease can be prevented or treated with healthy lifestyle choices as well. So here as we get started, so why is it that chronic kidney disease and heart disease, why are we talking about them here together? And part of it is because whenever the kidneys are not working well, that can put stress on the heart, right? With that, and that whenever someone has chronic kidney disease, their heart needs to pump even harder to get the blood moving through the kidneys, and this can lead to heart disease, which is the leading cause of death in the United States. And also, you've probably seen too, if you have chronic kidney disease, your doctor is probably talking to you pretty closely about blood pressure. Also, if you have diabetes as well. So all of these are very connected to one another. And so and we'll talk more about, especially here at the end with the prevention and treatment, things that you can be doing that will kind of help each one of these along the way as well with it. But that's the reason why we're talking about the kidneys and the heart, is because they both really affect one another. And so here, for our first slide here, we're going to look at what are the symptoms of heart disease. Now, we know that men and women, they have different symptoms that they are feeling with this. And so that's why we always encourage, if you're noticing some of these symptoms and you're feeling them, please call your doctor. Call 911 if you're feeling like you're in an emergency. We want to take each one of these very seriously whenever it comes to heart disease with that. And this is just another step of, listening to your body, right? And that's something that we talk a lot about on our coaching calls with Cecilia Health as well. And so, what are some of the causes of heart disease? So, the first one we're really focusing on here tonight is the cardiomyopathy here with that, and that is the thickened or enlarged heart muscle that and the cardiomyopathy, it causes the heart to have difficulty to pump the blood well. And so if we look right here at this picture here to the right of our screen, we can see what a normal heart looks like along with the dilated cardiomyopathy as well with that. And so that's the first one that is listed here with that, where this is the most common. It could be passed down by families with that, but you're going to see here that the heart is just having to do more work just because of the stretched walls, a little bit thinner walls right there as well with that. And so there's also the hypertrophic cardiomyopathy, again, passed down through families. And then there's also the restrictive one, and that one's also maybe not as common. Don't quite know what's going on there with that, but these are three common ones that are focused here on the thickened or enlarged heart muscle. With that, other causes of heart disease here, we're going, again, a very long list here with that, but first I'm going to focus here with the coronary artery disease with that, which is the buildup of fatty plaques in the arteries, and that's very common. This can be due to diet, exercise, obesity, smoking with that. Again, like I said, we're going to focus more on this at the end of our session here tonight, but really just lifestyle modifications can make a big difference in terms of your heart health. Some other causes of heart disease could be irregular heartbeats, cardiomyopathy, like what we just talked about, diabetes, drug misuse, stress, extra alcohol or caffeine. Maybe it's something you were born with, high blood pressure, smoking, heart valve disease, even medications or other supplements as well may be a factor too with that. And so, and we see here with the diabetes, high blood pressure, I talked about those even in terms of with the chronic kidney disease, that those are two things that we are also looking at for that. So again, very connected from one to the next. And so if we also look here at a heart infection and the heart valve disease as a whole with that. And so again, there's just more to the heart. As we all know, there's a lot of different layers, a lot of different aspects to it. So again, this is where if you're having specific questions as to your case or what's going on in your body, please talk to your doctor about it for more information as well with that. So those were the causes, and now here's more about what are the tests, how are they examining your heart. And what we see on here, an EKG, a Holter monitoring, an echocardiogram, and the exercise or stress test as well. You might have had to do some of these previously, or maybe your doctor has talked to you about um, trying out some of these different exams to see what is right for you with that. And so first off, the EKG it's a test that records the electrical signals in the heart, just to see how's your heart beating? Is it too fast, too slow? With that, there's also the Holter monitor that it's a ECG, a device that's worn during the day to again monitor the heart. And what's beneficial with that is it's able to, kind of see how you're doing with your day-to-day activities that you're already doing as well. Then there's the echocardiogram. That's again, it uses sound waves to create the detailed images of how your heart is at the time. And then there's also the exercise or stress test as well. That's typically done either on a treadmill or riding a stationary bike. And with this particular test, they're really looking at how is exercise affecting how affecting how your heart is doing with that. And so each one of these is important. Your doctor might suggest one of these different tests for you. Again, they would be who I would direct your questions if you're wondering what is right for you with that. Now, your doctor might also have had either has already prescribed different medications for you, or maybe you two have talked about different medications as well with that. So we're going to kind of talk about them briefly here tonight. I will say, in terms of with medication, knowing what is right for you, knowing what time of day you should take it, or what's the right dosage for you. Again, your doctor is a great resource for that. I also think your pharmacist, wherever you go to pick up your medications at, talking to them about your medications if you're confused or if you're wondering, what time of day is the best time for you, your doctor or pharmacist can really answer those questions. So first of all, there's the anticoagulants or blood thinners with that help prevent clots. This would be an example of like Coumadin or warfarin. Um, with that, there are several other medications available as well for each one of these, but I'll list off one or two names in case if you're taking it. There's also the anti-platelet agents as well that helps prevent the clots too with that. And then the two listed here are your ACE and your ARBs. This is what I would say I see the most for my patients with that. And these again, ACE and ARBs are very common. The ACE allows blood to flow more easily, and the ARBs keep blood pressure from rising. With that, your ACE would be an example of like lisinopril, ramipril, and nalopril with that. And then your ARBs are like valsartan with that. And so, again, your doctor might have you on several different medications because each one's doing something different as well with that. And so there are also additional tests for heart disease here with that, and that's the cardiac catheterization as well with that. There's also a heart CT scan, and then there's also the heart magnetic, heart MRI scan as well with that. So um, the cardiac catheterization, as you can see here, that it can help show any type of blockage in the heart arteries as well with that. And so there is a catheter involved, which I think we all understood from the name itself with that, but it's they would insert some dye, and then that way they can see, how's everything going for your arteries with that, and it shows up more clearly on the x-ray images taken during the test as well. And then there's the CT scan of the heart, where in this for this scan, you would lie on a table with a donut-shaped machine around you, again, as it rotates around your body and collects images of your heart and your chest. And then there's also the heart MRI, and this uses just the magnetic field and computer-generated radio waves to again create the images of the heart as well. So other medications that help with heart disease, again with that, there's the angiotensin receptor uh, neprolase inhibitors, and then there's also the beta blockers. This was another one I wanted to highlight as well with that helps to lower your blood pressure and make the heart beat more slowly with less force. And the beta blockers, that would be something like metoprolol, might be a common one that you've heard of as well. There's also the combined alpha and beta blockers, and again, help with blood pressure and heart failure with that. And there's also the calcium channel blockers as well with that can decrease the heart's pumping strength and relax the blood vessels too with that. So again, each one of these is important for its own right as well, and talking to your doctor, your cardiologist, to decide what is right for you as well. And so, and then we have cholesterol lowering medications. Um, Several people might be on a type of cholesterol medication. Something with the word statin at the end is very common for that. We also have the digitalis preparations, which increases the force of the heart's contractions. There's a diuretics or fluid pills are very common, something like hydrochlorothiazide with that. We also have vasodilators, again, that are meant to help relax the blood vessels and decrease the blood pressure. So sometimes the blood pressure is too high and we need to bring it back down with that. There's a lot of factors that go in with the medications. So what is the next step? What is something else that maybe your doctor's already talking to you about? And that would be potentially surgery for you as well with that. So um, and you can see here listed, there's several listed with that. And we have angioplasty, artificial heart valve surgery, atherectomy, a bypass surgery, a cardiomyoplasty, a heart transplant, a minimally invasive heart surgery, a radiofrequency ablation, a stent placement, and also a TMR as well with that. So I won't go through and read each one of these with that, but just so that you are aware that we just want to make sure that you are having those conversations with your doctor, right? So if they are saying, you know what, we need to talk about bypass surgery because we're noticing X, Y, and Z, you know, ask those questions if you have them. And um, but each one of these, as you can see here, is important in its own way, and it's very specific to the need of the patient as well. So, what are some lifestyle changes that might be beneficial for the heart disease? So, one of them, exercise, making sure that you are staying active. So, the American Heart Association recommends to have at least 5 days a week, 30 minutes of exercise with that. Now, your doctor would be the person I would recommend to have this conversation with, right? To say, okay, I see the guidelines that are recommended for the general public, but what would you recommend for me with that? And exercise, it could be walking in your neighborhood, it could be riding a stationary bike, it might be chair exercises, it might be doing some exercise class that you found on YouTube with that. You know, whatever it is that you're looking at, please do talk to your doctor about to make sure that it is appropriate for you and it is working towards whatever goals that you and your doctor have also talked about. The second point here, learn stress management techniques. This is again something that we do talk about during our coaching calls. Stress is a factor that not only for your heart health, but we focus on that pretty much for all of our coaching calls for the different topics because of how you are managing your stress makes a difference, right? And so for some patients that I work with, they might journal or go for a walk, talk to a friend, listen music. Maybe they practice some type of faith that helps to calm them down. There are even apps out there now that you can download that encourage meditation as well with it. So there are several ways to cope around it. And I often encourage people to just think to themselves like, all right, if whenever I'm trying to manage my stress, maybe plan A didn't work out. Okay, what's plan B? What do I want to try next with that? The third point is aim for adequate sleep of 7 to 8 hours a night with that. And again, if you're someone that you're saying, okay, I'm not I'm not in that range with it, um, I would have that conversation with your doctor then with that. I would also encourage you just to make sure, are you encouraging your body to go to sleep? Are you setting that atmosphere to sleep well with that? And if you're watching TV late at night or a lot of screens at nighttime, that can play a big part with it. If you're you know there's a lot of factors there. So I would just recommend to talk to your doctor if you're noticing you're having interrupted sleep or else you're just not coming you're having difficulties getting that sleep in. Also, smoking, as we saw, was a major factor for heart disease. And so quitting is something that I'm sure if you are smoking, your doctor has already talked to you about with that. Um, if you've been on the fence before and you're like, I think I'm ready for the next step, please do talk to your doctor. There are several resources out there that can help you with that. And so we would just encourage you to open up that conversation and also take your medication as prescribed. As you all know on our coaching calls, that is something that we ask every time with that as are you taking your medicine? Are you taking it as directed? You know, things happen sometimes, right? You might forget it one day, or you just need to go pick up that refill, whatever it may be. But we still want to take that medication as directed. And if for some reason it's it's affecting you, you're wondering if you're having some side effects, please do call your doctor about that as well, because they want to know if you're having troubles with taking it or if you're choosing not to, they need to know about that as well. So, these are some other 3 points that we've kind of already touched on, but I want to come back to with that. Along with managing your heart disease, your blood pressure, your cholesterol, and diabetes are all three so important as well for managing your heart disease. So, with controlling your blood pressure, uncontrolled high blood pressure increases the risk of serious health problems with that. Like I said, it can um, blood pressure plays a role for chronic kidney disease as well with that. And so we want to make sure that your doctor not only is checking your blood pressure whenever you are at the clinic with that, but if you're wondering, do you need to be checking your blood pressure at home? Your doctor is a great person to start up that conversation with as well. Also, we want to make sure that you're getting your cholesterol checked as well with that. And it's helpful in terms of with the cholesterol, not only to whenever you're younger, maybe doing like a baseline cholesterol to see where you're at there with that. Sometimes if a person has high cholesterol that runs in their family, as we know, sometimes we're inherited to having different health conditions as well. And so that's important to know about as well. So then you know kind of what to be working on, what conversations to have with your doctor as well with that. But cholesterol is something else we recommend to have checked. And then also with managing your diabetes as well. And so keeping your A1C under that 7%, right? Keeping it at the goal that you and your doctor have talked about for your blood sugars, again, is very important for this too. So, in terms of with the nutrition, what is recommended? First of all, control your portion size. I'm sure everyone here has heard about the plate method, right? Half of your plate is a starch and a protein, and the other half might be all vegetables or half fruit, half vegetables with that. And we want to by that plate method is one example that we talk about to really focus on how much what is your serving size at that meal uh, with that, because if you're eating more, you're eating more calories as well with that. And we just want to make sure that we're eating all the different food groups as well. So again, more fruits and vegetables that have more fiber along it, more fiber, more whole grains as well with that. And you'll see here it says 100% whole grain or have whole wheat as a first ingredient underneath the ingredient list is very something that is very easy to look at. It takes about another 2 seconds whenever you're at the store, but it is important to look at that food label and to look to see, okay, is what else is in it? How much fiber is in it? And we're also looking at what type of fats are in your products as well with that. And so we want to eat a diet low in saturated fat, and which we can do that by limiting the amount of animal fats from meat or high fat dairy products as well with that. So on the food label, it typically lists out saturated fat as well as unsaturated fat. Your unsaturated fat are those healthier fats. And so you'll see that more with nuts, fatty fish, avocados, seeds, oils, olive oils with that. And so that's what we're wanting, more of those healthier fats. There's also not only choosing low fat in general in terms of leaner meats, but there's also a lot of low fat protein sources. So again, we see here listed whole eggs, quinoa, egg whites, and fish are great options with that as well. And nuts and seeds, they have a lot of protein as well with that. And the last bullet point here again is with being careful about your refined carbohydrates, that's your sweets, your sodas, your juices, anything that's just, there's not a lot to break down. So your blood sugars not only go up and come right back down. We want to just be mindful um, of just adding the extra sugars into our diets as well with that. So um, sugars as well as with salts here. You're going to see here it says that 1 teaspoon of salt is about 2,300 milligrams of salt with that. And your doctor might suggest that you follow maybe a low sodium diet or a sodium restricted diet with that. And oftentimes, whenever they do that, we're looking at the sodium on the food label as well with that. And that would be something if a doctor has recommended for you to follow a lower sodium diet, we would say, okay, what is your goal for the day? Some ways to kind of work around that to help limit how much salt you're adding to your foods. Preparing or cooking your meals from scratch can make a difference. The next time that you're using maybe something like a spaghetti sauce or something like that, look at that food label. Look to see how much percentage of salt is in that serving size, and that might say, okay, maybe we need to make our own recipe at home, and let's see if we can try to cut back on the salt with it. Using different spices and herbs instead of just salt can make a big difference too in terms of flavoring your food. Drinking water and can help, but also whenever you're dining out, you can always talk to your server and tell them, I'm trying to limit how much salt I'm eating, so I'd like to add a little bit less to my meal. Or that might also change what you order whenever you do dine out as well. And you'll see here, planning ahead, making meal plans, it does make a difference with the patients that I know that do this. They just feel a little bit more confident in what they're doing for the week as well with that. So we understand making nutritional changes can feel like a lot of work in the beginning time because you're trying new things, right? So, and that's what you're during your coaching calls, if you're needing assistance with new recipes or what would we recommend as the steps for meal planning, please bring that up in your conversations as well with that. And then our last bullet point here, as you can see, it says to allow that time to have that treat if you're wanting it. We all just came back from the holidays. Yesterday was Valentine's Day, right? So it's okay to have that chocolate or to have that special meal or whatnot. We're talking for these guidelines, we're talking about in general, most of that time, how are we plating our meal or how are we seasoning our foods? And we want to be mindful about that as well with that. So like Ashley said at the beginning, if someone has a question, you can use the question tab here in the toolbar, and I'd be happy to talk about that. I know that we covered a lot of different topics tonight, and so you might not have a question tonight, but I hope this will have sparked up some questions maybe that you'll have for your coaching calls or with your doctor as well with that. So, all right. So one question that we have here, it says, when should I talk to my doctor about a concern I have with a medication? So and I'm going to assume maybe there was like maybe a side effect that you're wondering about, or maybe you're questioning the dosage. You're saying, I don't know if this is too much or too little with that. That's a great question to talk to your doctor about. I always think it's worthwhile to call your doctor's office, leave a message with the nurse, and just to follow up with someone can kind of help you feel at ease as well with it. And next one, what are some other good resources and in pertaining to nutrition and preventative care with that? My two that I would actually recommend for you first would be the American Heart Association. They have a lot of good information on their website with that, and I would check that out first. That was the American Heart Association. Um, I would say if you're also wanting more information, more regarding just like the food with that, uh, we actually did another webinar here at Cecilia Health called "A Happy Heart is a Healthy Heart," and I would check that webinar out as well. If you're feeling like you're just wanting more information, please check that out, especially in relation to diet. That's a really great one that covers a lot of good with that as well. So, um, any other questions tonight? Let's see. Oh, okay. Um, so I'm not checking my blood pressure at home. Should I? Okay, great question. So we did talk about how blood pressure can affect your heart health, right? Your affect heart disease. So this question, I would say go back to your doctor. Ask your doctor, should you be checking your blood pressure at home? Maybe you are on a blood pressure medication and and you're wondering, is it working for me? Is it not working for me? Talk to your doctor about checking your blood pressure at home. They can also tell you about how frequently you need to be checking it and what numbers to be looking for as well with that. But yeah, thank you all for all the questions tonight with that. And we do have a couple webinars here coming up here in March. One is Stop Focusing on What You Can't Eat and focusing on healthy eating with diabetes. We also have healthy eating with chronic kidney disease. So if you're really wanting just more diet information, please check those out. Again, you can always talk to your coaching call coach here with Cecilia Health if you want to if you have more questions as well with it, or you can also look at our Facebook page as well at Cecilia Health Coaching with that. But I just want to thank you all so much for joining us today, and we appreciate you participating and joining us. Thank you so much. Have a great evening. Bye bye.